Welcome to the Neal Clinic. You've made the right choice in getting a chiropractic opinion to your problem. Dr. Neal is here with me today, and he's going to provide you with information about today's visit and what you can expect. Dr. Neal, tell us about activator adjusting. What is that?
Well, it's a new way of adjusting the spine. It's called Activator Methods adjusting. I'm still working to correct the misalignments in the spine just like I used to do with manual adjusting, but now I use activator technique.
Now, when did this start?
About 30 years ago, two chiropractors in Minnesota developed a new method of adjusting the spine based on the concept that the more concentrated the adjustment, the less force you'll need. They developed an adjusting instrument called an activator that delivers a very fast and very concentrated thrust, but with less overall force. The speed of the adjustment is what's important. It's 1/300th of a second, so the muscles of the body don't have time to tighten up and resist the adjustment. That's a problem that chiropractors have always had with manual adjusting, and activator is a good solution.
So what are the benefits then?
From the standpoint of realigning the spine, activator works just like the older manual adjusting, except that it's a much lighter force and a much more concentrated adjustment. There are some cases where I can adjust a patient who cannot have manual adjusting. If they're in a lot of pain, if they have a severe disc problem, or have had spinal surgery, I can usually adjust them just fine once I know exactly what their misalignment problem is. The other big benefit is that quite a few people have some anxiety about someone popping or manually adjusting their back or their neck. They need care, but they just aren't comfortable with the thought of the popping sound that their spine makes with the manual adjusting. For those people, activator opens the door to chiropractic care because there's no popping or cracking at all.
Oh, that is really different. It's not what I think of when I think of chiropractic, and I'm sure many of our viewers don't think of this activator method as well. Do your patients ever get skeptical?
Sometimes a new patient is skeptical, but the proof is in the pudding. I mean, if a patient gets good relief, that's what counts. They really don't care how it's done as long as I get results. And I've done both types of adjusting. I opened my practice in 1982 doing some manual adjusting and some activator adjusting. Now I do activator adjusting exclusively because my activator patients got better results. And that's what patients want. They want to feel better as quickly as possible.
Absolutely. Now, when you say you're advanced certified in this type of adjustment, what does that mean? Did you have to take extra exams? Did you have to go through more training?
Oh, yeah. Activator Methods does not make it easy to get certified in this work. And once a doctor has passed the testing to get that certification, you also have to attend update seminars every 18 months or so, or you will lose your certification, and then you got to take all the tests over again. But it's good because I learn all the new research and the adjusting that they've discovered that year. Activator Methods is the most researched chiropractic technique there is. And there are about 3,000 activator-trained doctors in the United States.
Okay, so now what types of patients or what kinds of injuries is this method good for?
If you're having pain, something's not moving right in the joints of your spine. If you're taking medicine to hide the pain, you're not addressing the cause of your problem. Chiropractic does. If you have an auto accident or a fall, the longer you wait, the more difficult a problem you're going to have. I work with lots of injury patients who saw their family doc or even went to the ER, and they were told that their x-rays or their MRI looked okay. The medical radiologist who reads those x-rays does not look at the misalignments in the neck or the back because the MDs don't treat misalignment. I do. And with activator adjusting and the physical therapy that we use here, we work to correct the misalignments so you get better and you stay better. And in the case of an auto accident, the insurance company pays for your care, and I work with your attorney to provide the information they need to settle your case. So if your doctors don't know exactly why you're still hurting, you definitely need to see a chiropractor for a second opinion.
So Dr. Neal, you've had the consultation, you've had the x-rays and the examination. What's next?
After reviewing your exam and x-ray results, we'll talk about your treatment options. If I think we can help you, we'll begin treatment, focused on getting you out of pain as quickly as possible. The amount of care you receive and how long you stay under care is always your decision. If it turns out that you can't be helped by chiropractic, then we'll schedule another referral or some other additional testing to help find out exactly what is going on. And if chiropractic care will help your condition, we'll put you on a specially designed adjusting table which allows you to lie flat in exactly the same alignment as when you were standing. Then I'll be able to check the alignment by a leg balance test that helps me isolate the precise area of your spine that needs adjusting and the areas that don't need adjusting. If they're not broken, don't fix them.
Absolutely.
The activator, at first I was like, how is this little thing going to do anything? And I've been to chiropractors who've used manual manipulations and the activator, and some use both and some use either or. But the activator actually seems to have worked better because it's able to pinpoint the exact area that needs to be adjusted.
I didn't know about the activator before I came to Dr. Neal. I had had chiropractic adjustments in the past, and I felt that it made good, logical sense, and that it would be more comfortable for me, actually, and it is.
Well, of course, when you first see the activator, you wonder how painful it's going to be, because you have these sore spots in your neck, and they're going to use those on the sore spots. But it actually was not painful at all. It's not bad. It's not that much pressure at all.
I don't know what to compare activator treatment to. There's no other chiropractic treatment that I know of that's similar that way, but it doesn't feel much different than just a thud on your skin. I mean, it's very precise. He doesn't crack 50 bones to get to the one he wants. He goes to where he needs to adjust you, and that's where you get adjusted, and there's no pain, there's no discomfort.
The activator method is pain-free. It's very specific. You hear a click. It provides a certain amount of pressure in a particular area. It's not painful at all. You don't feel pain from that, and it certainly is more comfortable because you're not being twisted and manipulated.
A lot of people probably are fearful of coming to a chiropractor because they don't know what's going to happen. They've heard stories about people having manipulation and arms pulled up over their head and those types of things, but that doesn't happen here at the Neal Clinic. And I was kind of skeptical of it too before I came. But I came here and was completely at ease. The staff works very well. They keep you comfortable. The activator, as I said, is completely painless. And so if you've never tried chiropractic care, this is a place to try because it's unlike anything that you may have heard about before.
Because I have so much pain in my back from the surgery, I can't tolerate manual adjustments. And so to have the activator, Dr. Neal can do the entire adjustment from my neck on down with the activator, and I get wonderful relief.
Now let's take a look at a plastic spine and see exactly how the spine should look and what can occur. Looking at the spine from the front, we should see vertical alignment. This should be straight up and down just like a column supporting a building. From the side is where we actually want to see curves in the spine. There is normally a forward curve in the neck, backward curve middle back, and a forward curve in the lower back. These curves belong here. This should be straight up and down, vertically aligned. Now what happens with the misalignment of the spine is you'll see some shift from that normal, and that's where it begins to cause you problems. You will put abnormal stress on the discs, you'll wear out the joints back here, you'll begin to pinch the spinal nerves as they come out from the spine, and that's where you get the term pinched nerve. And that's what we're all about, is correcting the alignments of the spine, restoring your spine back to its normal position so that in the long run you function better and you're out of pain.
In just a moment, we'll begin the process of finding a solution to your problem. The doctor will be right with you.